Last year, a number of parents held off on getting their teens the COVID vaccine over concerns that it could cause heart inflammation. But now the CDC is saying COVID itself is far more likely to lead to heart problems in teens and young men. Tonight, our Rachel Krause breaks down the new findings that every family should know.
Last year, after the COVID vaccine rollout reached teens, pediatric cardiologist Ryan Serrano says he saw a slight increase in the number of healthy young men suddenly experiencing chest pain and trouble breathing.
When that cohort of 12 to 19-year-olds or 17-year-olds got their vaccine, we definitely saw an uptick of that, but it's definitely tapered off.
The CDC says cases of myocarditis and inflammation of the heart are rare following vaccinations in teens and young adults. And now, new data shows it's actually more likely to follow a COVID infection than the shot. The CDC reporting 12 to 17-year-old boys are 2 to 6 times as likely to have heart complications after COVID-19 infection than after vaccination. In young men 18 to 29 years old, they're 7 to 8 times as likely. Serrano says myocarditis can be serious, even fatal.
Most recover, but some don't. So you could be left after an infection with a lifelong chronic medical condition, if you're lucky not to pass away from it in the beginning. And with the COVID vaccine, not only have the cases been more mild, but I have not heard of anybody dying from COVID vaccine cardiac-related illness.
Dr. Serrano hopes this new data from the CDC can convince parents who held off to finally get their teenagers the shot. He says with COVID and with myocarditis, it's safer to have the vaccine.
This is safe, and it is something that's important not only for you, but for your kid and for the public health in general.
Now, if you're interested in getting a COVID shot, we've got a link to our state sign-up site. Just head over to WTHR.com/coronavirus.